सी ये जो न्यूट्रिशनल सप्लीमेंट है कीट के लिए, देखिए हम लोग ये कीट सप्लीमेंट कहाँ पर, कौन सी इंस्टीट्यूशन में we have done the trial, and trial is also going on. For example, SRM Institute of Medical College and Hospital and Research, Chennai, Sri Lakshmi Clinic, Velachery, Chennai, SK Clinic, that is your Chennai. Now, here I would like to tell you that prior to launching this product, we have done the trial. Now, we are doing the second trial, all those institutions. What are the things basically in case of children supplement we have to check? Number one, physiochemical things we have to check. आप पूछेंगे ये physiochemical क्या है? एक तो आपका appearance, उसमें क्या color, क्या odor means smell, कितना उसमें मॉइस्चर है, कितना आपका एसिडिक पीएच कितना है, दैट मीन्स वो एसिडिक है और अल्कलाइन है, उसका एसिडिटी मेजर करना पड़ेगा. विदाउट दैट दिस सॉर्ट ऑफ फॉर्मुलेशंस कैन नॉट बी गिवन टू चिल्ड्रन. नंबर टू, व्हाट वी हैव टू डू, वी हैव टू चेक द हेवी मेटल्स. ये जो चिल्ड्रन के लिए जो फॉर्मुलेशंस हम लेके आ रहे हैं उसमें हेवी मेटल्स है कि नहीं. आप बोलेंगे heavy metals. Which are the heavy metals you are talking about? Number one is the lead, mercury, cadmium, and nickel, arsenic. These are the heavy metals. Now we have checked our kit Nutri Immuno. There is a single heavy metal you will not find. Now, here others बहुत सारे आपका like fungus, you will find that lot of multi-level marketing company they have grown. They come with a nutritional supplement for children, but they don't do any sort of test. They don't check your heavy metal. They don't check the bacterial count. They don't check that even the bacterial count, overall bacterial count they have checked, but they don't check that is there any salmonella or E. coli. These are the things they don't check. Now here, in case of your kit Nutri, if we take into consideration, you see the microbial test. हम लोग यहाँ पर क्या किया, टोटल बैक्टीरियल काउंट कितना है ये सप्लीमेंट में, दैट वी हैव चेक्ड एंड इट इज विद इन द लिमिट और नॉट, वो भी हम लोगों ने चेक किया एंड इट इज विद इन द लिमिट. देन आफ्टर दैट हम लोग ये भी चेक किया उसमें इकोलाई है, सल्मोनेला है, ईस्ट है, ये सारे चीजें हम लोगों ने टेस्ट किया. अभी भी ये जो प्रोडक्ट मार्केट में है, ये मार्केट से ये प्रोडक्ट उठा के फर्दर हम लोग टेस्ट कर रहे हैं. ये इसका स्टैंडर्ड जो हम लोग मेंटेन किए हैं वो अभी भी है. इवन आफ्टर 6 months or after 1 year, the same efficacy is maintaining, and it's not everything we are checking, which is not possible. And for that purpose, I'd like to tell you that how much money we are spending for doing this particular test. This particular test, we are spending near about 5 lakhs rupees just to check that your microbial counts, even heavy metals, even also physiochemical structure. These are the things we are taking into consideration. Now, another thing is that ये जो सारे supplement है, ये even Modicare, even Herbalife, they have not thought about the clinical trial. Nobody has done clinical trial. Herbalife का जितना सारे formulations है, they have not done the clinical trial. And even also Modicare, they have not done. Even Abbott and Nestle has done few trials, but Abbott also, they have not done any trial for the fixed dose combination. Fixed dose combinations क्या? ये जो मेरा kit Nutri Immuno है, उसका स्टडी, दैट मीन्स उसमें आपका क्या क्या है, विटामिन है, मिनरल्स है, ये सारे चीजें उसमें है. आपका कोलेस्ट्रॉम है, डीएचए है, देन यू विल सी दैट there you will find that soya protein, then also you will find the concentrated whey protein. ये सारे है, but when you are putting all those things in one preparation, what will be the efficacy and what will be the side effects? Nobody do the test. Only Nestle, they have done 1 or 2 tests. Now आप देखो ये जो छोटा मोटा जो सब कंपनी है, see they cannot think about this type of trials and all those things. ये जो ट्रायल के लिए now the budget whatever we are spending, I'm showing you the protocol synopsis for this clinical trial which will be conducting in the next month, and how much we are spending for that. 25 lakhs rupees we are spending only for this clinical trial. Now I'm showing you that protocol synopsis. ये सारे चीजें हम क्यों दिखा रहा है? ये पूरा internal thing still I'm showing you so that you can talk to your customers that how much money we spend for clinical trial to check the efficacy of the product, to check the side effects of the product. Even ये product जब shelf में है, after 1 year, that particular product का जो efficacy, उसका फर्स्ट मंथ में जो एफिकेसी है उसमें कोई डिफरेंस आ रहा है कि नहीं, वो भी हम लोग चेक कर रहे हैं. दैट मीन्स इवन ऑल्सो वी आर चेकिंग दैट नेक्स्ट टाइम जो बैच नया बैच आएगा, वो नया बैच का जो एफिकेसी पहले वाला जो बैच है वो पहले वाला बैच का एफिकेसी एकदम सेम टू सेम होना चाहिए. उसमें कोई चेंजेस, anomalies we should not do that. Now see that it's an open level clinical studies to evaluate efficacy and safety of kids Nutri Immuno supplement. किसका ऊपर हम लोग स्टडी कर रहे हैं? कौन सी पैरामीटर हम लोगों ने लिया? एक तो ग्रोथ, सेकंड वन कॉग्निटिव फंक्शन, थर्ड वन इम्यूनिटी. Then also we are taking into consideration, we are telling that there will be no respiratory tract infection, there will be no allergic rhinitis, sneezing, running nose, nasal congestion. ये सारे चीजें नहीं होगा because immunity, when respiratory immunity will be improved, these are the problems will not find. Even also we are checking the gastrointestinal infection. You will find that the kid, they suffer from gastrointestinal infections frequently because their gut is very delicate. Here also we are checking that ये formulations देने का बाद gut health कितना improve हो रहा है, उसका digestion, उसका कोई flatulence हो रहा है कि नहीं, even उसका जो evacuations हो रहा है, that means उसका जो passing the stool, उसमें कोई problem हो रहा है कि नहीं, कोई constipations है, कोई irregular bowel movement हो रहा है कि नहीं because of taking this particular formulation, that also we are checking. Now this natural health matters, and we have hired the CRO, Clinical Research Organization, for the same to study this clinical trial. Now, here you will find that is your open level pilot interventional clinical studies. Here हम लोग ये parameters check कर रहे हैं. How many children we have taken? 24 children हम लोगों ने लिया. ये children जो है with malnutrition. देखिए एक चीज, अब देखिए आप लोग तो ये फॉर्मुलेशन मोर और लेस हेल्दी चिल्ड्रन को भी दे रहा है. हम लोग हेल्दी चिल्ड्रन वी हैव नॉट टेकन इनटू कंसिडरेशन. जिसका मैल न्यूट्रिशन है, माने खाना खा रहा है, हाँ, लेकिन वो बॉडी में एब्जॉर्ब नहीं हो रहा है, इसके लिए मैल न्यूट्रिशन हो रहा है. और खाना है लेकिन खाना नहीं खा पाते हैं बिकॉज ऑफ उसका एपेटाइट ठीक नहीं है, उसका इरेगुलर बाउल मूवमेंट है, हमेशा पेट फूला हुआ रहते हैं, सो उसका इंटेक ऑफ फूड इज वेरी लेस. दैट सॉर्ट ऑफ पीपल वी आर टेकिंग इनटू कंसिडरेशन फॉर दिस क्लिनिकल ट्रायल. ये जो 24 चिल्ड्रन, they are suffering from malnutrition, they are suffering from recurrent upper respiratory tract infections, even also they have a problem with the gastrointestinal tract infection. That means we are taking children who are in a diseased conditions. Okay, so there we would like to see that how much result we can get after giving this supplement. Then we are also taking into consideration as per the guideline of WHO, कि चाइल्ड का कितना ग्रोथ हो रहा है, जो स्टैंडर्ड ग्रोथ होना चाहिए वो हो रहा है कि नहीं. इवन वेट एंड हाइट रेशियो हम लोग चेक कर रहे हैं. इसमें देखिए इंक्लूजन क्राइटेरिया है, कौन से चिल्ड्रन को हम लोग ये क्लिनिकल ट्रायल में ले रहे हैं, 2 से 12 years. That means we are not taking years old of both gender. That means 2 to 12 years, that particular age limit we have kept. And we would like to see that because in case of children, your gut health, respiratory system is very delicate. There we would like to check that this particular formulation, how much it will be effective. So this is inclusion criteria. Even here, आप देखोगे ये GI infections है, even also respiratory tract infections है, we are taking those children. But one thing, exclusion criteria आप देखोगे, जिसका hospitalization require or maybe severe diarrhea, loose motion हो रहा है, those children we have not taken into consideration. जिसका malignancy और HIV है, ऐसा कोई children को हम लोग यहाँ पर include नहीं किया. So recommendations कितना दिया? 30 grams in 150 ml water, it will be given once daily in the morning. And that will be given for 12 weeks. And after 12 weeks, we would like to check the test group, that is 24 children whom we have given this thing. First, we would like to check 4 weeks, after 4 weeks, then after 8 weeks, then after 12 weeks. Then all data will be shared to you. So it will be a fixed 56 days, 8 weeks for each participant. So once we'll get this particular data, that will be shared among all of you, and then you will be able to show these things to your customers as well. Okay. Now, there are a lot of other parameters we have taken into consideration because we have to check other parameters in case of your children, so that we have included. Even also here you will find what are the things of primary outcome measures will check. One by one I can talk about. That is your height, weight, हम लोग check करेंगे. BMI का क्या change हो रहा है, that will be. Even also will see the emotional and cognitive function, उसका क्या change हो रहा है. Social skill, motivation, self-regulation, ये सारे check करेंगे हम लोग. Academic performance में कोई change आया कि नहीं, because हम लोग बार बार बोल रहे हैं जे इसमें DHA है, इसमें आपका कोलिन है, देन आइनोसिटॉल है. सो ये तीनों इंग्रेडिएंट्स ये न्यूट्रिशनल सप्लीमेंट में है. सो ऑब्वियसली कॉग्निटिव फंक्शन अच्छा होना चाहिए. सो एकेडमिक परफॉर्मेंस में कोई चेंज आ रहा है कि नहीं, प्री एंड पोस्ट, दैट वी आर. इवन ऑल्सो behavior also, assessment of evaluation of development and behavior questionnaire we have kept. Then we have also taken into consideration URTI, that means upper respiratory tract infection. Even GI health ka changes we are also monitoring. Then number of school days losses because of frequent allergic rhinitis, sneezing, running nose, nasal congestion. The children cannot go to school. That how many days earlier they were absent in the school. Now, after taking this kid Nutri, what is the improvement of that? Even also, we would like to check all vital signs. That means your respiratory any problem is there or not, or there is an improvement of that. Even also blood pressure, pulse rate, everything will be checked. Even also liver function, that is SGOT, SGPT, bilirubin, that will be also checked. Even also we would like to check that we are telling that it is trans fat free. So changes in the lipid profile, is there any change? These are the things will be checked. Even also we'll check the temperature. Is there any change in the temperature, blood pressure? These are the things we'll take into consideration. And you will get all the data within a short span of time. So even also secondary outcome will take into consideration CVC and RBC. That means your TC, DC, ESR, total total count, then differential count. That means in case of your blood we see that total WBC count kitna hai, RBC count kitna hai. Then WBC ka eosinophil, basophil, neutrophil, then lymphocyte, monocyte, इसका कोई change हुआ कि नहीं? That parameters, hemoglobin level, we will be checking that there is an improvement of the hemoglobin level. And then we'll also check this ESR. ESR will tell you that any inflammation is there in the body or not. So these are the parameters we have taken into consideration. We are going for extensive clinical trial. So we'll get a lot of clinical data that will be shared all of you.